about novel treatments. So what is out there, what is so-called cutting edge, what's the sort of the hype these days, so to speak. Okay, so stem cell therapy, which you guys may have heard about. It's basically a form of regenerative medicine. It's a concept of stem cells. It's usually harvested from the fat tissue, okay, and after that they grow the stem cells, then they inject back into the affected joints. And certainly because you have had the initial group of fat tissues, you can certainly produce more stem cell for that particular animal in future. So it is same again, it is not exactly, it's more of a management as well. Okay, so what's the concept of a stem cell? So basically, we all have stem cells. When we were first created, we started off with stem cells. Okay, when our parents, the sperm meet the egg, come back together, form one cell, and after that, that single cell became a lot of different differentiations. Some became eyes, some become nose, some become hair, some become skin. But we all started with the same cell. So that stem cell fundamentally is able to become whatever cell that is needed, sort of thing. So that's the whole idea behind stem cell. Okay, so what they have learned is, or what they've done is that they can actually take a bit of fats from the animal and actually cultivate and grow stem cells from that fat tissue. So we're talking about primary, all the way down back to the most basic cell before it differentiates into eye, nose, ear, skin, hair, and all our body parts, nails, and things like that. Okay, and what they've done with those stem cells is that they find that if you inject it into those affected joints, it can actually repair, and I do use the word repair, all the deficits that the joint has. Okay, and that is the whole idea behind it. And stem cell therapy has been used in humans for quite some time already, and it's only sort of in the last I would say about maybe 6-7 years come into the vet medicine, so it is something that is out there. Okay, so it is not straightforward. So the physical side of things, it does involve 2 sedation or anesthetics. The first one is to harvest a stem cell, which you must get it as clean as possible, as thorough as possible, from the fat tissue, which we usually obtain from the groin of the animal. Then send it off to the lab, whereby they generate the stem cells. Then they send it back to you. Then you have to sedate the animal again to inject into the joints. For future users, you don't have to do the first bit again because you've done it. They can keep the stem cells in the lab for quite some time. From what I understand, for the whole animal's lifetime. So we need topping up maybe once a year or maybe once every 2 years to those joints again. But that is out there.
After they've injected the stem cells, they have to keep the dog still for 4 hours. Mine's had it.
How was your experience with it?
Yeah, so he was sedated for an MRI to diagnose his issues, spondylosis and lumbar disease. So whilst he was under for the MRI, they harvested the fat cells from his groin and he's had them injected into
And how was the response?
He's a really hard dog to tell with, really.
Okay.
I mean, you've met him, you wouldn't know. Most people that meet him, you wouldn't really know that there's anything wrong with him because he's a spaniel. And he just spaniels. And again, the acupuncture is the only way we know. I opted not to go back for a top up, partly because I don't think it made like a miraculous difference.
Exactly.
Or whether it's because it's still having an impact, and partly because like the timing just sucked because it would have been due when I was due to open the business.
Yeah.
So,
fair enough.
But it was really interesting because I had to go to Gloucester first, talking to the vet about it. Because one thing that they can't do ethically is they can't keep putting the dog back under to then take another view to see whether or not it's having an impact. So you are very much going on anecdotal
Clinical science,
and clinicals. She's had a few where they've had to go under for something else, and then she's had a quick look.
Of course,
and has seen improvements. But whereas with a human, it's relatively easy just to
just lie down and take a picture.
Just lie down and have an X-ray or do whatever your MRI done.
Cool.
They can't do it ethically so much with the dog.
Yeah. So my experience is that. Exactly. So my it's quite similar. So I've got a case that we actually took because it had elbow dysplasia, and it was only 4 years old. So it's like rather than sort of telling that it needs to be on drugs for life and all the other things, the owners went for stem cell. And for that particular individual, we actually took off the medication because it was doing so well after that. So for that one, I was like, okay, amazing.
I mean, he is on no medication.
Yeah.
He's on no medication. Just has the monthly acupuncture in terms of pain
Sure.
management and some
Yeah.
restrictions on his walk, so you just wouldn't know. But they're both, you know, the degenerative conditions, along with bilateral TPLOs and
Yeah.
moderate hip dysplasia, so all the other things as well,
Mm.
that he's never going to get. And
Fair enough.
you mostly, people would see and you wouldn't know.
Fair enough. Yeah. So like for that particular individual, it was just good for that dog. For others, we had to go back for repeats, and sometimes they were better, but they still had to stay on medication. So it really varies. Yeah. Another thing is a platelet-rich plasma, so PRPs. So it's also another form of regenerative medicine. As the name suggests, it's a regenerative medicine. So it tends to regenerate things. That's the whole point behind it. Okay. So what they have also learned is that concentrating the platelets found in plasma. So plasma is a bit of the blood that we have, and you can concentrate the platelets in that. So it's harvested from the blood of the patient. So compared to stem cells, this is less invasive. You're just taking blood rather than taking sort of fats, so to speak. And once you sort of spin it down, then you can get the platelets out. The whole point of getting platelets is platelets are very, very good for healing. And that's the whole idea behind. So the idea is that if you inject something that's rich in platelets into a joint or affected area, it can heal those areas over there as well. And same again, this has been quite popular over the last few years as well. And certainly we get fairly sort of, I would say, mixed results with it. Some is amazing, some is not so much, some is repeating. Same again, just like any medication. So that is what's sort of available out there in terms of novel treatment, really.